Today we're going to be learning some directional terms and body cavities, abdominal regions, things that you have probably already learned if you've taken another health science class. But we will also be learning about the terms manner, cause, and mechanism of death. So let's get to it. Anatomical position is used to describe the positions and relationships of structures in the human body. We use this to correctly identify specific locations and directions when dealing with patients. And this is the position from which all directions and descriptions are made. Anatomical position is with the person standing erect or upright, looking straight ahead. Arms are down at the sides, the palms are facing forward, the fingers are extended, the legs are together, and the toes are pointing forward. We talk about anatomical position because when we are using these directional terms that I'll be talking about, it's important to know that we are talking about them with the body in anatomical position. And when we use these terms, we are generally comparing two things or two structures. So our first set of terms is superior and inferior. Superior means that a structure is above another structure. Inferior means that it is below another structure. Anterior means that something is more towards the front or in front of something else. Posterior means it's towards the back or behind. Dorsal and ventral are interesting terms. Dorsal means towards the back and ventral means towards the stomach. In a person in anatomical position, dorsal is basically the same thing as posterior, and ventral is the same thing as anterior. When these terms become different is if you're talking about like an animal that's on all fours, where ventral is on the stomach side, but anterior is by the head because it's on all fours. We don't have to worry about that in this class. Medial means toward the midline. So if we take a line and draw it right down the center of the body, medial is going to be closer to that midline than something else is, where lateral would be away from the midline. Proximal is body parts that are closer to the point of reference. Distal means the body parts are further away from the point of reference. Generally speaking, the point of reference for proximal and distal is where a limb attaches to the trunk of the body. Proximal and distal are generally only used when we're talking about arms and legs. Now we'll talk about body cavities. Body cavities are spaces within the body that contain vital organs. The dorsal cavity is one long continuous cavity that's located on the back of the body, and it's divided into two sections. The cranial cavity, which contains the brain, and the spinal or vertebral cavity that contains the spinal cord. The ventral cavity is larger, and it's separated into two distinct cavities by a dome-shaped muscle called the diaphragm, which is important for breathing. The two cavities are the thoracic cavity and the abdominopelvic cavity. The thoracic cavity is located in the chest, and it contains the heart, the lungs, the esophagus, trachea, and the diaphragm is the lower border of it. The abdominopelvic cavity is also separated into two cavities. The abdominal cavity, which contains the stomach, kidneys, small intestines, most of the large intestines, the liver, gallbladder, pancreas, and spleen. The pelvic cavity is the lower abdominal cavity containing the urinary bladder, the reproductive organs, and the last part of the large intestines or the rectum. Now we're going to talk about three terms that are related to death: manner, cause, and mechanism of death. And these can sometimes be a little bit hard to differentiate. The manner of death is the circumstances under which the death occurred. And there are 5 manners of death. Accidental death is where the victim died under circumstances that neither the person nor someone else brought about. The resulting death was not reasonably foreseeable. A natural death is a death that's caused solely by disease or natural processes. A suicide is the victim knowingly engaged in an act reasonably expected to end his or her life. A homicide is a death that is caused by another individual. This can refer to either a non-criminal act or the criminal act of murder. And the last is undetermined, and this is where we have insufficient information about the circumstances of the death. The cause of death is the medical condition or injury that led to a person's death. It could be disease, injury, poisoning. It's what is the medical reason for the death. It's the circumstance that initiates the chain of events leading to the death, the disease or trauma that directly caused the victim's death. Examples can include a heart attack, a gunshot wound to the head, a drug overdose. The mechanism of death is the physiological change that leads to the death. It's the immediate result of the cause of death, which is the disease or injury that causes the physiological change. Now, if we look back at causes of death, heart attack, not everyone who has a heart attack dies. Not everyone who is shot dies. Not everyone who has a drug overdose dies. So the mechanism can explain why that person who experienced that circumstance did die. For example, a heart attack victim could die from the deadly change in heart rhythm or from severe damage to the heart muscle leading to shock. Here, the cause of death is a heart attack, but the mechanism is a cardiac arrhythmia or a cardiogenic shock. The mechanism of death relies on important technicalities. A gunshot wound is a great example, but you could say that it's obvious someone was shot, so they die of a gunshot wound. There's no other explanation, right? The mechanism of death concept takes it a step further. A victim doesn't truly die of a gunshot wound. He dies of excessive blood loss caused by the gunshot wound. The difference seems tiny, but it means a lot. That means the mechanism would be categorized as blood loss. And to use the technical term, he dies of exsanguination. Think about dying from alcohol consumption, for instance. Alcohol would count as the cause. However, someone could suffocate on their own vomit or die from alcohol poisoning. Any manner of mechanisms could occur. As a result, the mechanism of death could be categorized in a few different ways. So just to reiterate, the manner of death, we have the 5 manners. Cause of death is kind of more like an event, something that happened to the person. And the mechanism of death is what changes happened in the body from the cause of death that actually made it so death occurred.